Good afternoon, everyone. I'm Justin Elicker, Mayor of New Haven, and I'm very excited to be here with Senator Blumenthal, who's been a very vocal advocate for New Haven and Connecticut for many, many years, in particular focused on communities that are really struggling to get by. And today we're here to talk about the proposed cuts in Donald Trump's budget, which eviscerate many of the social services that the federal government has provided for community members and communities like New Haven for many years. And to speak out against the fact that leadership in our country is turning its back on our community. This is Valentine's Day, and I think that we have seen from our leadership a lack of compassion, a lack of caring, a lack of love for so many people in our nation that make our nation strong. People that are coming from places where there is strife and chaos in their countries, people that are living in our cities like New Haven that oftentimes don't even have enough money to put food on the table. This is not the time for us to disinvest. Rather, it is the time for us to go the other way and invest in communities that are particularly struggling. And you know, to highlight the number of cuts, it's cuts in housing, it's cuts in food stamps, it's cuts in basically every social service that sends a lifeline to people that are looking to get by. And today we're here in particular to focus on cuts in health. And you know, New Haven, we've talked a lot about our concerns about coronavirus. And while there has not been a case of coronavirus, we are very aware of the potential of these types of diseases spreading. And we look at what happened in China, in part because there's not the kind of investment in the public health system to ensure that, like we have had in the United States, to ensure that our communities are safe. This is the wrong direction for us to go in, especially now. And I'm here with Senator Blumenthal to speak out against that. And I'm also here with our Director of Health, Marissa Bonds, and our Director of Community Services Administration, Dr. Dalal, because we stand together to say that this is wrong and this is unacceptable and it is not welcome in Connecticut. So I'd like to turn it over to Senator Blumenthal.
Thank you.
Thank you for being here.
Thank you. First, I want to thank Mayor Elicker, who is new to this job, but not new to the cause of social justice. And I wanted to be here today because he's been a champion of the safety net, of conservation, and of investment in our communities. We're here at the edge of New Haven Green, which is a symbol of a community caring for each other and investing in the future. We would not be here today but for the investment that our forebears made on our behalf without knowing us. They believed in investment because they knew that in the long run, it was in their self-interest to invest in education, in healthcare, in all of the common bonds that make America great. And what we are seeing now in Washington, D.C. is a betrayal of that long-standing American tradition. Invest in the future. Shredding the social safety net, decimating the education budget, ending the kinds of programs that are necessary for people to climb the next step, make possible the American dream, is not America. And I'm proud to be in New Haven, which has always recognized the importance of sound investment. And here in New Haven, we're also in a place that spurs and nurtures science. Now, Science appears to a lot of people as a kind of abstract enterprise. Today, I'm here to say science can help save lives now if we invest in it. If we develop a vaccine, for example, for coronavirus, which NIH can do, we will help save lives. And yet, the budget under this administration for NIH has been cut by 34% under this budget. We're talking about literally $3.1 billion cut from the NIH budget. We're talking about a nearly 10% cut in the Center for Disease Control and Prevention, the CDC budget, cut by almost 10% or $693 billion. The investment in global health programs, cut by $3 billion. A pandemic that engulfs the world in coronavirus is preventable, but only if we invest in the vaccines, in the prevention steps, in other measures that make common sense. China may seem like a long ways away, but infections and diseases spread rapidly in today's world. We are in an era of globalization economically and culturally, and public health is a global enterprise as well. It's in our self-interest to invest in the CDC and the NIH. Cutting the CDC by 10%, cutting NIH by 34% is tantamount to public health suicide. And so I call on the Trump administration to support bipartisan efforts, and they will be bipartisan already. Many of my Republican colleagues are expressing dismay about these cuts. Exactly the wrong time to be cutting investment in public health. And I am hopeful that colleagues will unite in this effort. And just so everybody understands, even if you don't care about public health, New Haven knows that when you invest in science, you also create jobs. The biologic and pharmaceutical innovation occurring now in New Haven among many of the startups and the ongoing companies creates jobs, and it spurs economic activity. In fact, NIH's budget is thought to create billions of dollars in economic benefits for communities where this research is done. So again, I want to thank Mayor Elicker. We have two great professionals here. I thank them for being here, and happy to take any questions that you may have.
Senator, could you speak a bit more to how these proposed cuts, the CDC in particular and NIH, make Americans more vulnerable to something like this?
Well, the CDC, as you know, does diagnostic testing, it does preventive action so that it can contain cases before they spread, it can educate and inform, and it can advise local officials about how they can stop infectious diseases from spreading. The NIH, very simply, invests in vaccine research, in treatment research, as well as diagnostic research. NIH supports and sponsors research that provides for better prevention through new vaccinations and other kinds of measures. CDC performs a public health prevention function. NIH is more research-oriented. And these cuts mean fewer grants, less spending, less resources that are available for the kinds of efforts that it undertakes.
And if I may ask the local health directors here, sure. You can field this as well, Mayor, how might this proposed federal budget impact the work that you all do at the city health
So absolutely, good afternoon, and I concur with our leadership, our mayor and our senator, Blumenthal, with the impact that this has. 59% of our budget at the health department relies on special funds to implement our mission, which is to promote, prevent, and protect. And so when we are talking about federal funds being cut, that is either directly being given to the local health or a pass-through through the Department of Public Health at the state level as a pass-through to local, it impacts us significantly to be able to ensure, number one, quality of life for those that are needed for services that we offer. And so I concur, and I hope that we can collectively unite as a front to inform the federal government that it's not wise for us to go this avenue when you're looking to do federal cuts across the board, because public health is needed so that we can ensure that the services and the individuals within our local city can be protected.
I was wondering if we could just expand it maybe a little bit, the cuts that involve just services more generally, populations that need it. Can you talk about that?
The more general cuts?
Beyond the health cut, other services that would benefit the Haven.
I mean, I
Go
unless
ahead.
you want to, so there's a proposal to cut Section 8 housing. You know, we're in a national housing crisis right now, and there's a $1.3 billion cut to the Labor Department, which is targeting unions. In a time when we need more reliable, accessible transportation, the president is proposing a 13% cut to the Transportation Department. Cuts to Head Start, WIC programs, low-income home energy assistance programs, and food stamps, and the list goes on. And all of those things should be familiar to everyone in New Haven, because we all know people that are benefiting from Section 8 housing and support for affordable housing through HUD. We all know people that are reliant on WIC and support for people to receive the nourishment that they need every single day. We all know people that are relying on so many of these things, and if they lose them, in some cases it's literally the difference between having a home and not having a home, having food and not having food, having health and not having health. And you know, as the senator said, this is the president's proposal. And I'm hopeful and confident that our other leaders at the Capitol can, through bipartisan agreement like has done recently with other Trump budgets, come to some sense of reason about what's appropriate and what's our ethical responsibility to our neighbors and communities. I also wanted to note Alder Crespo's here. Thank you for joining us, Alder Crespo. I don't know if you have anything to add, but if that gets to your point.
Right. I mean, there's not a whole lot of cooperation in Washington, but do you have some sort of faith that you said your colleagues are upset about this too, your GOP colleagues?
Well, the mayor emphasized an important point, which is this budget is only a proposal. And I'll give you another example that is very close to my heart. This budget envisions an end to college loan assistance. Think of it for a moment. Already, many students graduating from college this year will be saddled with humongous debt. The president's talking about eliminating just about all of the assistance to students who are in debt now and in the future. For example, the public service program, where students with debt can, in effect, be relieved of it as a result of public service, eliminated. More kids will come to school hungry. They will come from homes that are substandard because of lack of housing assistance. More kids will be at risk of disease and infection because of cuts in all of these programs. The only glimmer of light here is that many of these same cuts were proposed last year, and they were successfully fought because we raised our voices and we enlisted colleagues on both sides of the aisle who could sense the human impacts of these potential cuts. And what's so valuable about the professionals that we have here today is that they see and they can articulate the kind of damage that will be done. And a mayor ultimately is the one who bears the governance burden, because the lack of funding, the cuts in resources, have to be overcome at the local level, at the local and state level.
This is a question for the health professionals. Could you give us a sense of what the kind of response looks like on the ground to something like fighting or preventing a coronavirus outbreak, and how that might be impacted by budget cuts in a kind of concrete way?
The senator alluded to it earlier, in that we are reliant heavily on the CDC for guidance and protocols. The scientists and the public health professionals at the CDC guide everybody's work here. So this is a situation with coronavirus that is an evolving situation. There are many unknowns, and at the local and state level, we don't have the resources to discover what those unknowns are, but the public health professionals at the federal level are the ones that are responsible for that. They update their guidance almost on a daily basis, and it is that guidance we rely on to set up our public health infrastructure and response protocols here in the city and at the state. We work very closely with state health officials, who in turn work closely with CDC officials, and we need that, that type of investment and that type of infrastructure in place to even have a basic response.
I'll just give you some examples, just to finish that point. Some of the cuts in CDC, for example, 35 million cut to the Infectious Disease Rapid Response Program. That means they detect cases of coronavirus, CDC's response mechanism, cut. 18 million cut in the Hospital Preparedness Program. The hospital sees a case of coronavirus, CDC's program to help that hospital deal with it, to quarantine, to contain the infection, cut. On the global health funds, the cuts there are to the World Health Organization by 1/2, $64.7 million. The World Health Organization is, in effect, the global public health monitor and helper. It's in China right now. China was resistant to allowing the World Health Organization to enter because they were, in my view, resistant to any kind of potentially embarrassing news coming out of China. China's been a black box. We have no really reliable data from China. The World Health Organization are the professionals who operate worldwide. We're cutting our contribution to the World Health Organization. So these are specifics. There are a lot more, but I think that we can all agree that we should be increasing our investment, not cutting it to these kinds of organizations. We should be vastly expanding our investment, not decimating it. Okay, thank you. Thanks a lot.
So nice.